Newsday continues here on One News Now. I'm Riza Diaz. Indian scientists now warn the public of new minor mutations of SARS-CoV-2 which could possibly evade immune response. As they continue to figure out what led to the disastrous surge of COVID-19 cases in India, the Indian SARS-CoV-2 Genetics Consortium has now found more mutations in the coronavirus that needs to be tracked more closely. But for now, scientists say there's no reason yet to believe that these mutations are specifically dangerous. More contact tracers will be deployed in the NCR under the government's Emergency Employment Program. Over 5,700 contact tracers will be sent in 5 areas in Metro Manila under the Labor Department's TUPAD program. Quezon City, Manila, Muntinlupa, Parañaque, and the municipality of Pateros will hire contact tracers for 3 months. They will receive NCR's daily minimum wage of 537 pesos. Labor Secretary Silvestre Bello III said that this will not only provide employment for displaced workers, but will also help in the country's COVID-19 crisis. Now, as more women are expected to give birth amid the pandemic, health experts warn of possible effects of the virus and vaccines against it on pregnant women. Faith Del Mundo with the report.
It's not just COVID-19 infections that are on the rise, but also the number of expecting Filipino mothers. Health experts warn that if a pregnant mom is infected, they will be at risk for severe complications. While pregnant women are deemed not any more susceptible to COVID-19 than the rest of the population, health experts warn that the complications will be severe should they be infected with COVID-19. That is what Dr. Sibyl Liz-Ann Bravo, OBGYN from the UP College of Medicine said in Laging Handa public briefing.
Ang mga buntis po, hindi naman sila mas madaling mahawa. Pareho lang po yung chance ang mahawa ng COVID infection ng mga buntis doon po sa non-pregnant population, including mga males po at mga bata. Yun nga lang po, according sa ating pagsusuri, as experience po namin, kapag ang buntis po ay nagkaroon ng COVID infection, yun nga lang po, maaari itong maging mas severe, mas grabe po ang consequences.
Possible complications include low birth weight or preterm or premature delivery. Bravo said there is also a small chance for the mother to pass the virus to the baby while in her womb.
Pag nagkaroon po ng infection ang nanay at siya ay buntis habang pinagdadala ang kanyang sanggol, may mga complications po katulad ng mas mataas po ang chance na siya ay manganak ng mas maaga, yung preterm delivery na tinatawag. May chance din po na baka mas maliit ang sanggol kumpara sa mga babaeng hindi nagkaroon ng COVID. Yun po, at saka medyo may small chance po na baka sila ay mas CS kumpara sa mga buntis na walang COVID. Yun po yung mga complications na sinasabi natin. Added to that po, yung pag moderate to severe po, mas mataas ang chance na magkaroon sila ng more severe at critical state ng COVID infection pag sila po ay naging highly symptomatic.
To lessen exposure, Bravo advised that pregnant mothers should have limited face-to-face consultation with their healthcare providers, especially during the first trimester or the first 3 months of their pregnancy, and to only meet the doctor face-to-face towards the due date. Even then, she said it should be on appointment. She clarified that if the expecting mother has comorbidities, it will be a different scenario. After delivery, a mother who is COVID positive is still encouraged to breastfeed her baby. This is so she can pass antibodies to her child through the breast milk.
Ina-advocate pa rin natin ang early discharge, breastfeeding, at i-maintain pa rin pong hygienic practices, of course. So kung meron pong inuubo or may sintomas na isang tao sa bahay, tayo po'y lumayo na at dapat yung ating kasamang yun, household contact, ay magpa-test na at lumayo muna sa atin.
The doctor also reminds expecting mothers that an RT-PCR swab test is required if giving birth in the hospital. Since there is a limited data regarding COVID-19 vaccinations on pregnant women, expecting mothers should receive shots with precaution and only during the last trimester. But since there is a limited number of supplies, they are encouraged to be vaccinated after the delivery of the baby.
bakuna na po agad. Safe po ang COVID vaccine sa mga breastfeeding or sa mga postpartum o yung mga kapapanganak na nanay. Safe po ito. Please have your vaccine right away. Ngayon po 2 weeks na lang po. Kung due na po kayo ng second shot, please line up na po for the second shot. Ngayon po kung kayo ay beyond na po ng second shot niyo, no? Kunyari after 1 month, no? Medyo lumagpas na kayo, anytime po, pwede na po kayo magpa-shot. Basta at least 2 weeks na po kayo naka-recover at wala na pong sintomas.
For News 5, Faith Del Mundo, we are One News.
Now, here are some of the biggest development in sports. Volleyball players who missed the national women's volleyball team tryout in Subic could still make it to the squad competing in the 31st Southeast Asian Games in Hanoi this November. Recall that only 16 out of the 40 invited players attended the tryout for the national team last week. The absentee cited health concerns among others. PNVF board member and national team co-chairman Tony Liao says the country needs to send its best athletes if we want to win a medal. Thus, the PNVH or PNVF board was willing to be more understanding and to make room for the missing volleyball stars, including Eliza Valdez, Gia Morado, and Don Macandili. Since most of the absentees play in the Premier Volleyball League, plans to include the national team in the bubble of the league's first season have been hatched to give Coach Oji Mamon an opportunity to hold practice sessions without fear of contracting COVID-19. Gilas Pilipinas 3-on-3 players are gearing up to become the first Filipino basketball team in the Olympics since 1972. Top-ranked 3-on-3 players Joshua Munzon and Alvin Pasaol and 2019 Southeast Asian champs CJ Perez and Motao Tua will go to Graz, Austria for the FIBA Olympic qualification tournament on May 26-30. In an interview with Radio 5's Power and Play, Pasaol said that they will do their best to bring Philippines to the Olympics. The Gilas 5-on-5 squad will also make its own bid in the Olympic qualification tournament in Serbia in June. And PBA coaches are willing to wait until the coronavirus situation in the country becomes better to kick off the league's 46th season. But league officials are seeking permission from the IATF to begin 5-on-5 scrimmages as soon as the current MECQ and NCR Plus is lifted. While it waits, the league has made vaccination for all its players and stakeholders a priority. Meanwhile, the league has also imposed a 20% slash on salaries while play is suspended and will revert back to full salaries once scrimmages start. Operations of land transportation offices in Metro Manila and nearby provinces will resume tomorrow. The agency announced that LTO offices in NCR, Bulacan, Cavite, Laguna, and Rizal will reopen tomorrow after suspending operations due to ECQ and modified ECQ. LTO also reminds the public to follow strict health protocols inside the offices when transacting to prevent the transmission of COVID-19. A Johns Hopkins health expert reminds vaccinated individuals to remain cautious on who they are interacting with. Virologist Andrew Pikosh explains why on Bloomberg.
Vaccination will not only protect from severe disease, it'll protect from symptomatic disease, and will even reduce transmission. So getting vaccinated is going to now have a major impact on the pandemic. We assumed it would, and now we have the data to support that. So these relaxations of the guidance of the public health restrictions for vaccinated individuals reflect the fact that if you get vaccinated, you pose less of a threat to the rest of the population in terms of passing this disease on to people. So I think that's a good thing that you're seeing.
Andy, I think some people are still struggling with the logic of certain requirements of them, though. So let me give you an example of it. You go into a restaurant right now in New York City, you can sit down with your friends, take your mask off and have a meal. But if you dare stand up and walk to the restroom, you better put that mask back on. Now, Andy, I say that in a flippant fashion. You'll forgive me, I'm sure. But that's how people feel right now. They've been vaccinated. They go into a restaurant, they sit down, they take off their mask, they eat, and then they walk to the restroom and have to put the mask back on. What is that about?
Well, partially it's to also think about the other groups that you're not interacting with. As a vaccinated individual at this point in time, you really should be paying attention to the groups that you're interacting with. We're not giving people a free rein to just go out and socialize with anyone and everyone. We still have to be careful in terms of who you're interacting with, because we want the rest of the population to also reach this level of immunity so that we can have further blockades in terms of the ability of the virus to transmit. We don't want to rely on one individual and their immunity to protect the entire community. We need other people to get involved in this. And so while vaccination reduces the risks of transmission tremendously, it doesn't eliminate it. So until we get to a level where most of the people are vaccinated, it's still good to have some of these reminders that we're not out of the woods yet. We still have to be careful and measured in terms of how we're approaching this pandemic.
Andy, are public health officials at odds in some ways with the elected officials that are trying to get their economies going quicker? I mean, the idea here that you have the likes of Mayor Bill de Blasio saying everything's going to be reopened, while you've got the CDC that still won't give guidance saying that you can go and be part of a bigger group if you've been vaccinated.
Absolutely. These are going to be conflicting goals in some perspective. I think there's no public health individual that wants to see the economy continue to be shut down. All public health individuals, have families, have lives. They want to get back to some semblance of normalcy. It's just a question of the rate at which we do this. It's a reminder when you look at the case numbers that they're falling, but they're still at a very high level. And with vaccination rates slowing down across the U.S. in particular, we are a little bit worried that we're going to hit some sort of plateau of vaccinated individuals that's much lower than what we need to really make a major impact on the spread of this virus. And I think that's the real area where we're conflicted in. How do we keep pushing to get the immunity up in the population? Because that will eventually allow us to open up in a much more safer way.
Andy, how effective are vaccine passports? Some people have complained that perhaps they're not that effective because we don't know how long the vaccine will remain effective for. So if it's 6 months, they won't be applicable after that. Other people saying it's just a political issue that they're not being implemented currently.
Well, I'll leave the politics aside, but if you speak from the science, a vaccine passport that has an accurate date in which you've gotten your initial vaccination and your booster will actually is a relatively good way to keep track of your immunity. We'll know over time how long that immunity goes. So if you have documentation of when you got vaccinated, you can be put on that scale of how relatively protected you are. So scientifically, there are ways that you can capture this information to be accurate. Obviously, politically, it's a whole other issue in terms of whether or not people want to go to that extreme and for what things they want to have a vaccine passport to allow them to take part in those.
And those are the top stories of the hour. Join us later again at 2:15 in the afternoon as we monitor the day's biggest stories from sunrise to sundown. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. Mask on, wash hands, and stay safe, Philippines. We are One News.